We are Stirling Autism Research, otherwise known as STAR, and this video aims to share some of our recent research. Today we will be summarising a journal article by Ailey Cage and her collaborators Kirsten Corden and Rebecca Brewer called A Systematic Review of Healthcare Professionals' Knowledge, Self-Efficacy and Attitudes Towards Working with Autistic People. We all sometimes need access to healthcare, and for autistic people, there are often barriers to high quality healthcare. We know that autistic people experience high rates of mental and physical health difficulties, but when they try to get help from healthcare professionals, are they getting the support they need? Additionally, healthcare professionals like doctors or therapists could be gatekeepers to diagnosis. They could either help or stop someone from accessing an autism diagnosis in the first place. In this study, we wanted to bring together the existing research on healthcare professionals' knowledge about autism, their self-efficacy, which means confidence in working with autistic people, and their attitudes towards autistic people. There are a lot of studies already out there looking at these topics, but until now, no one has brought all the literature together. Doing a systematic review is a way of doing this. The systematic review of the literature was conducted in November 2019. The studies we included in the review had to use quantitative methods, for example, report statistics or other data, looked at the topic of knowledge, self-efficacy or attitudes towards autism, and included a sample of healthcare professionals such as doctors, nurses or medical students. The studies included were published in English between 1994 and 2019. Overall, 35 studies were identified, spanning many different countries and occupations. Across all the studies, the number of participants totaled 8,398, and we rated the quality of the methods used by the studies as moderately good. This means that most studies seemed to conduct the research to a reasonably good standard. Looking at healthcare professionals' knowledge, most studies focused on knowledge of the core characteristics of autism. There was lots of variation in autism knowledge. For example, between 47 and 71% of questions were answered correctly on an autism knowledge questionnaire that was used in several different studies. Of the 27 studies that investigated autism knowledge was poor to fair, suggesting room for improvement. People working in healthcare specialities such as paediatrics or psychiatry tended to have better knowledge of autism than general healthcare providers such as GPs. 6 of the 35 studies looked at self-efficacy and found moderate confidence overall. More self-efficacy related to greater levels of knowledge about autism, more experience of working with autistic clients, and receiving autism-specific training either during or after qualification. Looking at attitudes, 2 studies found some healthcare professionals felt discomfort about working with autistic people. There were also some studies based in cultures where the healthcare professionals had beliefs in curses and enemies causing autism, as well as poor parenting. It's important to say that we know these things do not cause autism, and these findings show how cultural values and beliefs can infiltrate into healthcare. These findings show that we need more high-quality training for all healthcare professionals, so that all these professionals have a good knowledge of autism and ability to support autistic people with confidence. At the moment, limited knowledge, poor attitudes, and low confidence among healthcare professionals are all barriers for autistic people accessing healthcare. Thank you for listening to today's video. Please subscribe and click the bell button to be notified when we make another video related to autism research. If you would like to learn more about our work, please follow us on Twitter and visit our website. You can also find a link to the full paper in the description below.